Unmasking the truth. Discussing point of views. One voice. One station. Sherepunjab Radio. AM 600.
Dr. Lam, Sat Sri Akal, welcome to the program.
Yeah, hi, good afternoon.
Good afternoon,
Thank you
sir.
for having me.
So, Dr. Lam, I was telling in Punjabi that there are many scientific discoveries, inventions that happened just by chance. So, let us know this 1 minute test about COVID-19, which is in the news nowadays. How did it start?
So we have been doing study using the breath, the air that we breathe out from our lungs to detect early lung cancer. But with COVID, we use the same technology to detect the people who are infected with COVID-19.
So where are we now? Is it almost, it's been standardized or not yet?
So we have tested several hundred people, some that are positive for COVID-19 by nasal swab, and others are negative. So we identify some potential signature or markers that will allow us to validate or test this method further. So if we are successful, potentially we can detect people infected with the virus within 1 or 2 minutes. 1
or 2 minutes. That'll be really quick, and that'll be almost a solution for the problem because life will be a bit easier once we have that test. So kindly make us understand, how does the COVID-infected person breathes? What are the ingredients of that breath that you guys are targeting?
So when we are infected with the virus, we change the metabolic pathways in the lung. So it changes the chemicals that we breathe out from our lungs that we can detect. So this is what we are using, the chemicals in the breath that we are trying to analyze that is specific to the infection.
So it'll be easier for the tools you and your other partner is using. It'll be easier to differentiate the COVID-19 infected person's breath from the other infections.
Yeah, that's what we hope to achieve. So potentially this kind of technology can also be used to detect people with influenza, for example, and other viruses, if the signatures are different.
Doctor, I have heard that certain experiments are being done that dogs can sniff better, so they can find out the drugs, they can find out many kinds of cancers. Do you think that dogs can detect? I mean, just a vague question, I know that, but does it make any sense when I ask you that?
Yeah, so my colleague Dr. Myers is working with a microbiologist, training dogs to smell COVID. So potentially the dogs can do that because we know dogs can smell other bacteria. For example, we call C. difficile that can cause diarrhea, and MRSA can cause a wound infection. So dogs are a very sensitive smell sensation. They can do that, but dogs are very difficult to multiply to many situations, right? So they are specially trained dogs. So that's why we need to have a machine that can simulate the dog smell, but allow us to use it in a portable fashion in many settings.
Dr. Lam, how far are we before this 1 minute test is standardized, finalized?
Well, we have identified some potential chemicals that allow us to validate further, but we need to do the validation test before it can be used clinically.
So, lastly, are we you and your partner in BC are the leading scientific team in this horizon, or there are some other parts of the world that are trying on the similar grounds?
Yeah, so we are collaborating with a team in Loughborough University in UK. So both of us are working together. So they work on more advanced cases of COVID-19. We work on people coming into the testing station that have minimal symptoms. So potentially they can have different signatures or similar signature. But our goal is to actually use the breath test to detect people with minimal symptoms.
I can see it, visualize it in the days to come when this test is standardized. In the banquet halls and large gatherings, people will be, I'm pretty sure they'll be breath tested in the days to come.
Yeah, that's what we hope to do. Just like going to the airport, someone swap our computer and get the result right away.
Dr. Lam, thank you for your time.
Unmasking the truth. Discussing point of views. One voice. One station. Sherepunjab Radio. AM 600.